Hi, I'm Cherie Young, the practice manager at Vitality Natural Wellness and Med Spa, and I'm also a registered nurse. And we were talking today about ketogenic diets and how it's quite a popular buzzword right now. So you don't have to be working out in a CrossFit gym to have heard that phrase. It's on lots of websites, and our patients have been asking us about that as well. So I just want to address a couple things about that. The first is, what is ketosis, or what is keto? Keto is just a state that our bodies are in. It's a metabolic state with we're burning fat for fuel instead of glucose. When we do that, we are making ketones. It's a byproduct of using fat for fuel, and that puts us in ketosis. So those are some of the terms that you'll hear in conjunction with a ketogenic diet. A ketogenic diet was originally, it dates back to like the 1500s. It's a diet that was used for epilepsy. It became studied really heavily in the early 1900s, but it's effective for reducing seizures. They found that when they stopped a patient from eating for a length of time and they were only given proteins and fats primarily, very, very low carbohydrates, their seizure disorder was much improved. It's almost like as effective as medication for that type of condition, and there's a few other conditions as well. But people are using it now for weight loss and to put on muscle. So it can be very well done. Make sure if you're reading things online, always for anything, check your sources. Make sure you're using legitimate, reliable sources. Make sure they're quoting their studies and that you're getting good information. We actually have a program here, the Clean Start Weight Loss Program, that is essentially a ketogenic diet as well. That diet is low in fat though, and so there are some newer versions of ketogenic diets that are they're very low carbohydrate, but they're also lower in fat, and the original diet was high in fat. You know, we only have 3 macros. If you don't count alcohol, we have carbohydrates and fat and protein, and you can't have just one without adjusting the other. So if something goes down, something else has to go up. So there's lots of different approaches to that diet. There's also another kind of adjunct therapy you can do, and that is intermittent fasting with your keto diet. So that's IF or intermittent fasting. We can see negative effects on the metabolism of women that do intermittent fasting, especially really hardcore and for a length of time. So one option that we recommend in our office often is for patients to use Crescendo intermittent fasting, and that would be that you're fasting for 2 to 3 days per week. And this fasting is between 12 and 16 hours, and that sounds like impossible to do. But if I say you can eat from 10 a.m. to 6 p.m., you go, oh, that's not so bad, because you get up in your morning and you have your cup of coffee, and it's not technically fasting, but black coffee without cream or sugar we say is okay. Herbal teas are also fine. And then, you know, you have your lunch, you have your dinner, and 6 p.m. you stop eating. So it's just finding 10 to 6, 12 to 8, you have your 8-hour block of time that you eat, and the rest of the time you don't. It gives us, our bodies, a chance to rest from digestion, and it gives us a chance to go into that ketosis and that fat burning mode, because we're not burning all the carbs all day long. So anyway, that's Crescendo, or that's intermittent fasting. Crescendo fasting is when you do that just 2 or 3 days per week instead of 7 days per week. So if you are CrossFit or strength training, weightlifting, on those days you would eat normally. And so 3 days a week, when you have your stronger workouts, you eat normally, and you have your normal, in terms of times that you eat, you're eating throughout the day. On the opposite days, your days off from your intense exercise, you might do yoga or walking. Those days you do Crescendo, and intermittent fasting, so you're intermittent fasting those days. 2 to 3 days a week fasting, and then the rest of the week you're eating throughout the day. That has less negative effects on our metabolism, especially as women. We see some hormonal changes with fasting, and sometimes they're not always what we want them to be. So it helps to work with people that kind of know what they're doing about it. So if you have any questions, if you're interested in any of the programs or services we offer here, you can always give us a call. 419-989-4342 is our Mansfield office, and 614-717-1767 is our PAL office. Thanks.